We are now live on Facebook.
Hi everyone, and welcome to the EasyMSA hosted The Long Haul, Stories of Perseverance and Recovery from COVID-19. Thank you so much for joining us this evening. I'm Tehseen Ladha. I'm a pediatrician and assistant professor in the Department of Medicine at the Faculty of the University of Alberta. And I'm really excited that you guys have joined us to listen to COVID survivors' stories today. And I'm just going to start with some announcements and acknowledgements. So this session is being recorded and it will be posted on various social media platforms. When you use the comments or questions, your name may be visible both on this webinar and afterwards on the recording. I also want to make a land acknowledgement and recognize that we are webcasting from and to different areas of Alberta today that are located on Treaties 6, 7, and 8 territory and are traditional meeting grounds and home for many Indigenous people. I also want to disclose that the EasyMSA and speakers have not received any external funding for this event. The EasyMSA, or Edmonton Medical Staff Association, is a local society for 1,700 physicians in Edmonton with a focus on advocacy, education, and connection. We represent physicians across Alberta and advocate for patient care issues, health system changes, and the medical profession. During any time during the webinar, please feel free to ask questions and insert comments, which we'll get to both during and after the webinar is over. And do this by entering your comments on the Facebook Live or into the Zoom chat. So we'll now go into our session for this evening, and I want to say a big thank you to our guests who are here today, who will be speaking about their own experiences with COVID-19 and really putting themselves in a very vulnerable position by telling us their medical histories for the purpose of creating awareness of how significant the impacts of COVID-19 can be, not just on certain populations, but on people who are of all ages and of all levels in health and fitness. I'm going to pass it over to Dr. Shazma Mithani to introduce herself.
Thank you, Tehseen, and thank you everybody for joining us today. My name is Shazma Mithani. I am an emergency doctor who works in both adult and pediatric medicine in Edmonton, and I have been a strong advocate for the control of COVID-19 over the last year of this pandemic, and I'm happy to be here today. I'll pass it on to Katy, who will introduce herself and then introduce our first panelist.
Hi everyone, thanks so much for being here today. My name is Katy Ingraham. I'm the co-owner of Fleisch Delicatessen in Edmonton. I'm also the co-founder of the Edmonton Independent Hospitality Community. I agitate on behalf of the Canadian Restaurant Workers Coalition for changes for the hospitality community. And I also agitate with both Dr. Ladha and Dr. Mithani as part of the Go for Zero group here in Alberta for a more robust response to the COVID-19 pandemic. And I'm going to introduce our first survivor. Thanks so much to Ashley Antonio, who's a criminal lawyer in Edmonton. She got COVID in March 2020 and has been suffering with long COVID ever since. So thanks so much to Ashley for being here, and I'll hand it over to you so we can hear your story.
Thanks, Katy. So I was asked here today to just kind of talk about my experience with COVID and my lingering symptoms. Initially, I got sick at the end of March of last year. I had a kind of normal flu-like symptoms, and at the time, really, they weren't testing anyone that didn't have severe respiratory issues. So after calling 811, I thought that I would be fine and tried to just get through my flu. I started to feel a little bit better after a few days. But unfortunately, the symptoms returned and then went away for a few more days and then returned. And that continued for about 5 weeks. Eventually, after about 6 weeks, they started progressively getting worse and worse. And I know that there was a day in May, that was my first hospitalization, that I ended up going to the emergency room because I had an extremely high fever and I was hallucinating. And my husband, who's a firefighter, was working night shifts. And he said when he came home, he heard me talking to voices in our bedroom. And I told him that I don't remember this now, but he told me that I was saying that I couldn't feel the whole left side of my body. So he assumed that I was having a stroke and brought me to the emergency room. When I was there, unfortunately, I was a bit of a medical mystery to everyone because all of my test results, with the exception of my D-dimer and my blood tests, were coming back normal. So they knew that I had inflammation in my body, but they couldn't explain my symptoms with any tests, which was terrifying at the time because obviously, as someone that was previously extremely healthy and working out 4 days a week and working 12-hour days and was very, very rarely ill, that was my first time ever in the emergency room for something like that. So I was terrified. Eventually, I became a bit more coherent, and they ended up releasing me despite not being able to explain my symptoms and just kind of hoping it would get better. Unfortunately, it didn't, and I was back again a week later. At that time, anytime I moved any part of my body, my heart rate would skyrocket to about 175 just from moving my leg, and my oxygen would drop to about 75. So they started getting more and more concerned, but again, had no explanation. And once again, after spending the night, I think most of the next day in the ER, they sent me home and said, come back if it doesn't get better. And this continued for quite some time. I feel like I live at the U of A hospital now, unfortunately. But I ended up getting an amazing emergency room doctor at the U of A in July when I returned. And she referred me to the long COVID clinic in Edmonton, where I started working with my team of amazing specialists. And there are so many. I have 2 or 3 neurologists, now a pulmonologist, a rheumatologist, a cardiologist, etc. But my symptoms didn't ever improve. So I ended up I was on disability for 5 months from work, but I started to lose what was left of my mind a bit, just sitting at home and being trapped. So I tried to go back to work. But the symptoms at that point were intensifying in a way that it wasn't just heart related, and it wasn't just a shortness of breath and coughing and fatigue related. And not to say those weren't utterly debilitating, because they were, but what scared me most was the brain fog issue. I'm someone that's gone to school for a long time, and obviously I use my brain quite a bit in my job. And I was at the point, and still am some days, unfortunately, that I couldn't remember what things were called. I was holding a glass and I couldn't remember what it was called or how to use it. I couldn't remember my husband's name. I couldn't remember my siblings' names. And it was terrifying because that's something that I've never, ever had an issue with. And I didn't know if that would ever get better. Unfortunately, it's subsided a bit. And most days, my brain is relatively functional. But that's something that still lingers, and that's really difficult. I also ended up getting diagnosed at my long COVID clinic with a syndrome called POTS syndrome, which is postural orthostatic tachycardia syndrome. That's a difficult test. But it is an autonomic nervous system disorder. So it impacts my heart rate and blood pressure, breathing, digestion, a number of other systems in my body. So it's quite difficult to manage and is very debilitating. I've also been diagnosed with post-viral arthritis, which is something I didn't think as a 36-year-old woman I would have to be dealing with. And recently it was a confirmed diagnosis of chronic fatigue syndrome, which is something that I had no concept of how debilitating it was, obviously, until I began to suffer from it. But there are many days now still, over 14 months later, that I just physically can't get out of bed. But I also can't sleep, and there's no good sleep There's debilitating headaches. The body pain is extremely intense most of the time, and paired with the arthritis, it's unpleasant to say the least. And I think the thing that scares me the most about that is I've spoken to a lot of people in the chronic fatigue community who have been very supportive, but they've been struggling with it for 30 years, 25 years, 15 years. And many of them just got it after having a flu, and they were having a normal life, and any kind of virus can trigger it. So that was really horrific for me to find out, and to be able to speak to these people. And it's very comforting to realize that I'm not alone, but it's terrifying to think that this could be something that is debilitating for the rest of my life. And I think at this point in the pandemic, it's with the vaccinations coming out, I'm very hopeful that hopefully we can get through this, and people will start to feel better. But what's been most distressing to me lately, and I think what's been impacting my mental health mostly as of late, is the fact that people won't be locked down, and they'll get to go back to their lives, and they'll get to travel, and they'll get to be healthy, and they'll get to go out with their friends. And I feel like this pandemic is just something that's made me kind of on permanent lockdown. I don't know if I'll ever be able to travel again, which is something I loved. I don't know if I'll ever be able to exercise again. I don't know if any of my relationships will ever be the same again. So as exciting as it is to see things start to get better, it also reminds you of the fact that you might not ever get better. So I think right now the mental hurdle is what's most difficult. I've learned to manage a lot of my symptoms. It's still extremely difficult. In court, often I'll have to take long breaks. I'll have to go in the back room and put my feet up to get blood back to my head and my heart, which is obviously awkward. Luckily, people are very kind in my profession, but I'll often have to stop during submissions to catch my breath because I lose my breath. I have to write down every single word that I'm going to say because I can't rely on my brain to get me through if I need to ad-lib something. So the life changes, I can't put into words how impactful they are, and how much a very mild, what I would consider a very mild case of COVID just completely destroyed my body and the life that I had before this.
Thanks,
But I'm
Ashley.
not sure. Yes, thank you.
That was, I mean, for me, that was really hard to hear for me. I'm sure it was hard to hear for everybody else too. I mean, you said you were a young, otherwise healthy person before this. Did you ever expect that anything like this would happen after getting COVID?
God, no. Not for a second. And obviously I'd heard of COVID in March, but I didn't really know much about it like everybody else. And I don't know if I was necessarily taking it. I mean, I was wearing my mask when I went out. I was taking it seriously in that way, but I had no idea that a minor case could do something like this. And I don't think most people did.
And it sounds like you're really like nowhere near back to your level of functioning before this, like that you're really still struggling even with day-to-day activities.
Absolutely. Some of my symptoms have gone away, but they've been replaced by other ones. One that is very, very frustrating, that's a newer symptom, is smelling things that aren't there. I smell cigarettes, smoke a lot when there's no smoke around, or I'll hear ringing in my ears, or I'll hear like a bass sound and it's not there. And it's just so disturbing to think what's going on in my brain, that I'm hearing things that aren't there and smelling things that aren't there. So yeah, it's old symptoms that leave and then new symptoms that come.
Ashley, thank you so much for speaking about this, because I know it must be so hard, and especially looking towards the future and thinking that your life could be permanently altered by this it's so devastating. And, I really want to thank you for the courage you had in speaking about this so publicly, and also to ask you, what made you want to bring awareness to what you went through, and what made you want to tell your story?
I think that I would love people to take it seriously and realize it could happen to them, because I think before this, I was someone that was very empathetic and compassionate to anyone that was in this situation or would have been in this situation. But I think I also naively thought, I'm young and healthy and eat well and work out, and this isn't going to happen to me. And it's just it's disturbing to realize that it can happen to you, and being young and healthy doesn't mean anything, and it can destroy everything for you. So my hope in being open about this and being open about it for the past few months has just been that people will take it seriously and be careful, and just to not have this happen in their own lives.
Thank you, Ashley. I think that's a really powerful message.
Thank you.
Thanks. And, I think that one of the things often that gets missed about this is there's a lot of focus on hospitalizations. There's a lot of focus on deaths, but not enough people are talking about the ongoing effects of what happens to people who didn't necessarily even have to go into hospital at their initial COVID, like during the acute phase of their COVID illness, right? Like Ashley, you said that your initial illness was quite mild. It wasn't until after, like in the weeks and months afterwards, that you started to have all of these symptoms and then had to go into hospital. And so, that's one of the reasons that we wanted to get this panel together today, is just to give people an idea that, young, healthy people who didn't have to even be hospitalized for their initial illness are struggling with these ongoing symptoms. So again, we really appreciate you telling us your story today. Thank you. So we're going to chat with our next guest here. So Jen Elliott is here to speak with us today. So Jen is a senior planner with Edmonton Public Schools, and she's joining us today. We're really happy to have her to tell us about her experience recovering from COVID-19 as someone who was previously very active running marathons, and has really been struggling with, again, initially mild symptoms, but being able to get back to her baseline, very active and athletic self after this. So thanks again, Jen, for being here, and we're looking forward to hearing your story.
Happy to be here. So I tested positive at the end of November. It was very mild. I didn't have a fever or a dry cough. So I woke up one morning with a pretty bad headache and brain fog. And at that point, I think it was the beginning of wave 2. So I was a little bit paranoid. So I decided to get tested right away, because something about it just didn't seem like a normal cold, even though I wasn't feeling super sick. And then between getting tested and getting my result, I lost my sense of taste and smell. So that's when I knew for sure I probably had COVID. And then sure enough, got the test result, and it was still shocking because at that point, I didn't know anyone that had tested positive. Still have no idea where I got it. My partner also tested positive, but both of us were being careful, staying at home, working from home. So it was just kind of weird. But luckily, like those flu-ish, cold-like symptoms went away, like the headache and the sniffles and all those kinds of things. But I feel like the brain fog really persisted for a while. And even like thinking back over the winter, it all kind of seems like a bit of a blur. The two biggest things I think that I've struggled with long-term are the loss of taste and smell, and then just returning to a level of fitness I was at before. So like, even though I was technically recovered, I felt like I really wasn't. So like with the taste and smell, it's still not 100% back. I'd say it went away completely for 6 weeks and returned a bit. My smell never fully came back, but like by late January, I feel like a large number of things just started to taste kind of like chemical-y, poison, like just really gross, like, and that's persisted consistently through to now. So things like onions, garlic, coffee, even like pouring a glass of tap water smells awful. Peanut butter, like all these things I always used to eat. So not incredibly debilitating or anything, but I mean, my partner and I love to cook. I was never really a picky eater, would eat just about anything. And now I feel like I'm kind of like a 5-year-old kid, just sticking to the same basic meals over and over because everything is just so gross. And then, so the second thing, like Dr. Mithani said, I was training for marathons last spring that both obviously got canceled, but like kept up that activity level, got into road biking last summer, was doing some online workouts. So like really active, like running about 80 kilometers a week. And so the point of that story is just like being young and healthy and consistently active won't prevent you from getting COVID. And like, I know most people by now know it's not just the flu, but it is definitely not. And I learned that as I was trying to get back into running when I was recovering. Like, I mean, I've had colds before and kind of knocks you out for a week. And then the week after that, you just listen to your body and get right back at it. And like your fitness, nothing's really impacted. But this was like pretty different, even though like I wasn't coughing and my breathing was fine. I was still pretty fatigued for quite a long time. And then even online, I was reading like horror stories of like young athletes, mostly in the States, that had mild COVID cases like mine that returned too quickly and had all these like major cardiac issues. So that kind of scared me a bit. So I knew that I needed to like be super cautious. So, I mean, like I said, with a cold, you'd be back at it like within a week. This, I didn't go for my first run for like probably 6 weeks. And even then, it's super short, like 30 minutes. And my heart rate was as if I ran like a half marathon. So I was like, oh my God, like this is crazy. And so from that point, I probably spent months just running a couple days a week, 5K max. And it's like, you're totally starting from scratch. Like my motivation was really low. I had a little bit of a weird sensation in my lungs that I was kind of worried about. So I didn't try and push it. I feel like I'm kind of now, like we're 6 months later, back where I was before, which I mean, that's kind of like recovering from a major running issue as opposed to just a little sickness. So I think the biggest takeaway from that is that I would hope people would take their symptoms seriously, no matter how mild they are, and just respect the recovery process. And so even though my long-term COVID effects weren't totally debilitating, like back in December, so it's like cold, dark, food is gross, can't run, can't see my friends, Christmas is basically canceled. So, I mean, I can see how COVID definitely impacts your mental health as well. And so I kind of wanted to talk a little bit about like the long-term shame associated with testing positive. And like, even to this day, I don't have many friends that have admitted or wanted to share that they have had COVID, which like statistically, I feel like I should know a lot more people that have had it, which is too bad. And I mean, I suppose I've been kind of guilty of that too. I haven't shared a whole lot about my experience up until this point. Right off the bat, I obviously told all of my close contacts as soon as I got tested, which was also a little bit shameful because on the one hand, I'm like, okay, there's probably 6 or 7 people I might have been close contacts with. Like, is that too many? Like, was I doing something wrong? So luckily, none of them tested positive. But I also felt like really bad and pretty guilty, like, because they had to isolate for 2 weeks. Some of them couldn't work, some couldn't go see their families. So luckily, like my friends are pretty great and were super understanding about it, but I still felt bad. And then especially not knowing how I got COVID, I had like this feeling like, was I being irresponsible? Like somewhere along the way, I obviously should have been more diligent. Like I was wearing masks, sanitizing, social distancing. And it's like, you see on social media, all these like rodeos and packed beaches. And it's like, those are the people you envision getting COVID, not the ones that are like wearing a different mask every day of the week and like Lysol wiping their groceries. So it's like, I hope, didn't really want to share my story because I'm like, I don't want people to think that I was at these parties or whatever. But I think like at the end of the day, most of us are following the public health measures and like really trying our best to keep ourselves and our friends and family safe. But like when community transmission is so high, like even a low risk activity doesn't mean no risk. So I think people really need to be kind to themselves and to each other. And maybe hopefully more people be open about it, because it's really easy to judge someone and assume they've been acting totally irresponsibly. But in the end, it'll just make it harder for people to share their experience. So that's my story.
Thanks so much, Jen. Really appreciate you being here and telling your story. We're going to go over to our last and final survivor sharing their story. Chris Harvey is the owner operator at the Church of John, Geoscapes Events, and FKH Co. He's also the co-founder of the Edmonton Independent Hospitality Community, and he's going to speak on his experience of having COVID-19. Over to you, Chris.
Awesome. Thanks everybody for being here, and thanks everybody who's watching and listening in. I tested positive for COVID June of last year, June of 2020. I was the first person I knew outside of one or two other people who had tested positive. And, you know, just as Jen was kind of saying, it was especially early on, obviously not as early as Ashley had gotten the virus, but it was early enough where the shame and blame was massive. I work in the hospitality industry. I've worked in arts and music and, you know, a togetherness culture for the last 20 years. And all of our businesses were shut down in March. So we, you know, we're all in this together, we like to say, but unfortunately, we're not. These are very individual portions and I guess repercussions that we have to deal with. So for me, it was initially a mild COVID diagnosis. I was in close contact with a few people, but luckily out of a couple of people we had gone hiking with, nobody had gotten the virus from me except for my partner. So it was super challenging. My initial concerns were, am I going to be okay? I have no real long-standing health issues except for some susceptibility to bronchitis. And I've not been diagnosed with asthma. My brother does have asthma, but it's not something that prevents me from doing anything on a regular basis. I'm 40 years old and quite active. Right before this, I was not quite as fit as Jen probably was for training for a marathon, but I was running, on average 25 to 30 kilometers a week, quite fit probably. And I'm very active, you know, on a normal daytime before COVID hit, I would be walking, you know, 20,000 to 30,000 steps, no problem. So this is definitely, it was a change for me to be locked down and to have to challenge, you know, the recovery. And I did have shortness of breath right away. That was, I didn't have a fever. I didn't have traditional flu-like symptoms. It's much more of like a cold body ache. I was kind of reminded when Ashley was talking about your body just shutting down and just kind of stopping you from being able to proceed. And that was, I guess, my first red flag. And at the time, we didn't qualify based on the checklist on the website for a COVID test. So because my partner worked out of town at the time, we just went anyways. So we called 811, and 811 also informed me that based on my shortness of breath at rest is what I think the term was, that I should go and get my blood O2 checked at the hospital. And so I went right away. It was obviously not that pleasant to go to the hospital mid-pandemic, but it was amazing. The doctors, nurses, the receptionists, unit clerks, everybody was incredibly amazing. I expected the shame and blame that I got from my friends, my family, but we didn't get that. You know, I wasn't given I was given a different color sticker, but it was very subtle, and it was awesome to be able to experience that and not have a fear of some hospital worker blaming me or quarantining me off. It was all really, really an amazing experience, even though it was quite invasive and a lot of tests, blood tests, blood O2 tests. And it was the first experience. I think I was there at the hospital for about 5 hours. My blood O2 was in a normal-ish range. My heart rate was quite high. And so they kept me and continued to test until my blood O2 returned to, I believe, above 95%, which it sounds like it's quite high, but I very much like now, I do have to take breaks. But then it was from a seating position, not talking, being able to get 1 or 2 sentences out before having to take a couple deep breaths or allow yourself to catch up. If I did do that, I would get quite lightheaded, and I would have, I would have to stop. I wouldn't have a choice. So they did send me home with a puffer and told me if symptoms, get worse, call 811 and speak to a nurse. I think that's one of the biggest things I can advise everybody else, and I've told other people who have talked to me about it, is call 811. It's been fantastic. And also speak to a nurse or nurses and doctors as frequently as are available. You guys are the experts, and while there's a lot that's unknown, speaking to long COVID and how this still is affecting me a year later is something that I didn't anticipate. Initially, once we got out of our quarantine, it was the best day ever, going for a walk and getting to be outside after being locked down for 14 days. And I kind of attacked it head on. I did an interview with CBC. I talked about it with as many people as possible. And I'm really grateful for that, because one of the benefits of having all the businesses closed is that my business was closed, so it didn't affect our business negatively. And I could help remind people that it's not your fault. It's not something that any of us have anticipated or signed up for. This is just something that it happens. And we did all the right things. We did sanitize our groceries. We were diligent with masks. I was in close contact between, 15 and 25 people over that, 10 to 14 day period prior. Not one of them had contracted COVID except for my partner who I lived with. And so it does show socially distancing, masking does work. These things are helpful when you're doing them. But when I thought I was in the clear, about a month later, I had gone for a walk. I didn't feel great. Had a really slow start to the day. And I thought it was just, one of those days you're having a rough one. And I went for a walk with one of my friends, went for about an hour walk. And again, I've been running, almost 100 kilometers a month. So to walk for 5 or 6 K isn't a big deal. And when I got home, I was quite lightheaded, quite a bit of pain in my chest that I've never felt before. And it increased. And it not only did my shortness of breath at rest increase, I started getting dizzy, and my fever kicked in. So the old man in me reminds me that, it's not always great to suck it up. Sometimes you just need to check in. But I didn't want to go back to the hospital. That's kind of the last thing I wanted to do. And I was still concerned about getting COVID again, even though I'd already gotten it. So I called 811, kind of pled with the nurse on the other line not to send me back to the hospital. Is there anything else I can do? But unfortunately, I had to go back. So I went back after another 5-hour experience, more tests, more COVID tests. I was allowed to go, but my blood O2 had dropped again, much lower. This time, not quite as low as Ashley's, but still in an unsafe to send me home zone until about 4 or 5 hours later, where I was able to be given a puffer. They gave me a steroid puffer, and I'm supposed to be taking that 4 times a day for the rest of my life as of now. I try not to do that. I know it's a small sacrifice to make, considering everything else that's going on in the world. But now that we're focusing on ourselves and our own recoveries, we have to remember that it's not a competition. Everybody has been affected differently. This is very individual in our recoveries. And while we can talk about it and share with each other about what's going on and what's happening, we have to still acknowledge the long-term effects of this and what people are going through. And also, look for the proper paths to recovery for each of us while we're going through this, and recognizing as a community that it has killed a number of our friends, family, and it's hasn't gone away. Its effects are lessening. We have vaccine rollouts that are helping around the world. There's data and more information, but it's not over, and it's not something you want to get. I will be the first to admit, when this happened in March, or even when I got it in June, I thought, piece of cake. If this is all I have to deal with to get us back to reality, let's all, follow herd immunity. Let's all get this thing and kick it. It's not that way. I might get a little emotional here. I didn't expect other young people like myself to die. One of the things I'm really proud of is, in talking about this, especially early on, it did fight the shame. I have a big mouth for anybody who knows me. So it's easy to combat this, have conversations, have challenging conversations, and also agree to disagree. But what it also did is allowed people to talk to me anonymously or off the record, and ask for help. And I highly encourage everybody who's going through this, or don't be tough. Use your resources around you. Use your phone of friends, and take it seriously. I've had, in the last month, I've had two friends of mine, one in his mid-20s, one in his mid-40s, both just send me a text of them with either a hospital band or a respirator in their face. A 25-year-old with a respirator in his face, being in a hospital for 2 weeks, saying, I know what you're going through. And in competition's sake, no, I had a much less severe. I am very encouraged that with a puffer, with things, I can get back to most of the things I enjoyed prior. My shortness of breath is just as severe as it was the day I got COVID a year later. But hopefully it's not that way for everybody. But it is much more severe than what I think our general population is admitting to. And one loss of life is too much. If it's preventable, it's too much. And our threshold for bullshit and all these things that are happening in this world right now, it's higher. And it shouldn't be that way. Katie and I talk about it, and we like to reiterate that it's due to no fault of your own. Sure, there are some people out there being unsafe, not following public health guidelines. But as much as I like to say that, I don't think it's their fault. It's not. We can make better decisions together, and we can sacrifice more to get through this in a better way, save more lives, but it isn't anyone's fault. And we have to remember that when being empathetic to other people and listen to other people's stories. So yeah, I could go on forever, but I'll stop there. But thanks for the opportunity, everyone. We appreciate it.
Thanks so much, Chris. And as Chris said, we're friends. It's very emotional to hear him tell his story. And thank you to everybody, Jen, Ashley, for being so vulnerable and telling your stories. And when Chris says, it's not your fault, we both work in hospitality, so public facing jobs. And a lot of times it isn't people's fault. They're just going to work. And these are the consequences of what happens. So we really, really appreciate all of you telling your stories. We've got a couple questions. So from Facebook, we had Jennifer ask, first of all, she points out how devastating and that she's so sorry. And that she read somewhere that long haulers, some of them had some of their symptoms resolved upon receiving a vaccine. So has that been any of your experiences? Have any of you gotten the vaccine? Have you seen any impact on your symptoms after having the vaccine? Maybe Chris, go to you, because I know you.
Yeah, I got vaccinated. One of the joys of being old. I was vaccinated, and I had a pretty rough 12 hours. It was very similar to the first time I had symptoms from COVID, but they did subside. But no, I actually had to refill my puffer prescription afterwards.
And I had the same experience. I got vaccinated in early April because the beautiful gift of COVID is now I'm on drugs that impact my immune system. And I had no effects from the vaccine. I didn't even have a drop of blood. I said my body's just probably trying to suck it all up. But yeah, nothing yet, but here's hoping for the second one.
I had a similar experience to Chris. Like, I got vaccinated 2 weeks ago, I think. And yeah, the first day was very similar to the very early stages of having COVID. And then after that, it's been the same.
Right.
Thanks. So we do have, I'm going to go through a couple of questions that came in actually over email before as we were advertising the event. So one of them relates specifically to the brain fog. And so it sounds like this person is someone that is suffering with long COVID. And they ask, what the heck is going on with our brains? And so, there is a lot of, all three of our guests here today have kind of described some form of just this cognitive disability, essentially, right? Where there's this brain fog, this inability to think properly, to get your words straight. And so the evidence really does show with kind of the new information that's coming out about long COVID, the more we learn about it, is that brain fog and headaches and neurologic symptoms are really quite common in long COVID survivors and can be quite debilitating for weeks up to months and, maybe years. We don't know, right? Like Ashley was even talking about how she's still having these ongoing issues 6 months later with word finding difficulties and this brain fog. And unfortunately right now, because COVID is still so new, we won't really know how long these symptoms are going to last for years to come until we do more research and gather more data on that. So thanks for that question.
And I'll just add that as we heard from all of your stories, pretty much every organ system can be involved in long COVID. Like from your head to your toes, you can have symptoms affecting your brain, your heart, your joints, your muscles, your lungs. And so it really is such a wide range of devastating implications. And I think, I just wanted to be able to comment on Jen and Chris's stories. Thank you so much for sharing those. So some of the things that you guys brought up about the shame of diagnosis, I think is so important for people to hear, because this has been such a rapidly evolving pandemic where knowledge has been coming in at such a fast rate. So the things that we were instructed to do and were thought to be safe near the beginning may not necessarily be the same now. And, as you guys said, even if you're as careful as you can be, especially when community transmission is so high, no activity is low risk. And so it really isn't your fault. And I think that's important to acknowledge. And I also think it's important to acknowledge that as community transmission goes up, people are more at risk of getting it, even when they are being as safe as they can. And the other thing is, I think it was Ashley, I think you brought up how many people can get similar syndromes after other viral infections like influenza or the flu. And that's true. And I think the issue with COVID-19 in particular is that it has infected so many people. And when we look at some of the statistics of how many people may acquire long COVID, there's some research showing that 10% or more develop long COVID for symptoms greater than 3 months. And there's, if you're looking at symptoms over a month, you're looking at 20% or 30%. And just in Alberta alone, we've had 200,000, like over 200,000 people who have had COVID. So that's 20,000 people that could be experiencing symptoms for 3 or more months, which is such a ridiculously high number of people who are suffering unnecessarily. And as our guests aptly said, this is preventable. So this shouldn't have happened. So yeah, so thank you guys again. And there's questions both for guests and the panelists. And so I'll let Dr. Mithani and Katie bring some of those up.
Thank you. So this is a question for the panelists that I'll read out here from Scott Beach. So as extraordinary survivors of the most devastating experience, what is your ask of your physician allies going forward, i.e. your family doctor who is your health collaborator in the medical home?
I think, I know how hard it is for doctors right now, and I can't even imagine being a doctor at this moment in Alberta. But I think, I know my family doctor is a wonderful doctor, but this is something that I don't know if he's able to keep up on all of the research, because I think keeping up on all of the research is a full-time job in itself, honestly. At least I feel like that for myself. So I think just listening and taking it seriously. I obviously don't know the male experience going to see a doctor, but I know a lot of times as a female, my symptoms have been discounted. My pain has been discounted and dismissed as not as painful, or I've often been told at the beginning of this, like maybe it's anxiety. And I think just as doctors, I know what I would appreciate, and I think the people that I've spoken to as well, just really listen and take it seriously, and acknowledge that in a case like this with such a novel virus, I think the patients are able to teach physicians quite a bit about what's going on if they're willing to listen.
Yeah, I would say, just recommend anybody who is a family doctor, or maybe try to encourage more access. I think for me, I don't get sick enough to have a family doctor. Luckily, I just got into a new one. And then also too, kind of like Ashley was saying, not discount our comments, not discount our pain or our issues. It's hard enough to come and explain what's happening. I come from a generation where you just fight through it and everything's fine. You go to sick, work, you go to school sick, everything, you just kind of tough it out. And also too, until Ashley spoke, I didn't even know there was some specialized information or community that we might be able to have access to. So I would recommend sharing that, or if you don't have the time to research, which I'm sure nobody does, to be able to at least have that link to be able to direct people to more specific help if that does come across your plate. Like everyone's saying, 20% is still a lot.
Yeah, and I would agree with both of those comments. I've had a similar experience to Ashley, where a lot of things haven't necessarily been taken seriously. So I think as a patient and doctors learning about this, like to just be compassionate, take it seriously. Even like for me, having such mild symptoms, I didn't even think to go to my family doctor because I wasn't quite sure what she would say. So yeah, I think just being more open.
Thank you.
Thank you.
We have a question that Ashley was directed at Ashley, but I think it's an important question to talk for all of the panelists to talk about, because Chris sort of alluded to it as well. So the question is about, is there disability coverage at your work, and were you able to qualify for short-term or long-term disability pay as required? Is there a case manager, and do they understand the balance between rest and return to work? Is your employer accommodating your illness as it fluctuates? So, if any of you don't feel comfortable answering that, that's totally fine as well. I know Ashley said that she's sort of an open book, but I think it's really important because, as Chris alluded to, there is a culture, at least in the hospitality industry, of going to work sick, and there's a reason for that. So I'll let him speak to that.
Yeah, fortunately, there is the short-term access on the Alberta website to be able to get some short-term funding, but no, I'm kind of in a specific category because I'm a partner in my business, so I don't qualify for regular EI or anything like that. So I can't get all the same benefits, but that being said, it's been okay. but we definitely need more long-term solutions. This has always been a band-aid approach, I think, while we're figuring it out. And now that we have a lot more data, it's important that we get more consistent support, because the majority of people I've spoken to, they're just going into debt and they're just getting the bare minimum support that's available.
I know in my case, I was very lucky, and hearing what you just said, I feel even luckier now, but my employer does offer good benefits. I was on short-term disability that just kept getting extended. And I think realistically, being part of the long COVID clinic would have allowed me to be eligible for long-term disability if I didn't go back to work. Though working from home has been a huge advantage as well, because if I do need a break, I can go lay down, I can take a break, and then I can go back to work. And I think that we'll see when things kind of go back to normal and I have to go back to an office setting or back to the courtroom in person all of the time, how that's going to go. It's a scary thought. But I've had my employer's been very accommodating. Everyone's been very supportive, and I had access to benefits. So really, I was in the absolute best case scenario, and I think that it's a really rare scenario, unfortunately, for people to be in.
Thank you for that. So we do have a question that I'm going to direct towards Dr. Ladha here. So there's an anonymous attendee who's asking for more information on how to secure a proper diagnosis. So they write, listening to Ashley's story, thanks for sharing that, Ashley. There are quite a few things that can be involved. There's also no multidisciplinary long COVID clinic in Calgary, only a pulmonary clinic that has 2 to 10 months of a wait list. So they're asking about something like a standard operating procedure for family doctors that could help, and then increasing awareness about long COVID is lacking currently in the medical community. So a specific question about kind of how to secure the diagnosis and how to increase awareness in the medical community.
Yeah, those are great questions. And I think, some of the issues have been touched on about how, because this is such a new condition, and some of our guests here spoke about this, there isn't as much expertise quite yet, because it's such a new condition. And so in terms of securing a diagnosis, there isn't necessarily a standardized definition of long COVID that's agreed upon worldwide at the moment. Some people have suggested that if you have symptoms greater than a month, and others have said if you have symptoms longer than 3 months, and that can include any of the symptoms that we've spoken about today, affecting the different organ systems, then you would qualify really for a long COVID diagnosis. I think in terms of creating awareness, that's such a great question and concern. And I think, we're hoping that sessions like this will help increase awareness amongst the community about long COVID and how many people are suffering from it, and provide some sort of comfort as well in knowing that each person isn't alone, and that there are many others out there who are experiencing this. And I think the other piece to that is something that Dr. Mithani and I can take back, and it's good advice really about how can we reach the medical community, and how can we educate the medical community to be aware of these symptoms, to look for them, to be, as Jen said, really open and compassionate, and listen to the patient in coming together to collaborate on a diagnosis. So thank you for that.
Thank you. We had a question that came in prior to the event, and I think it's really important because Ashley touched on a little bit about talking about her mental health. So the question was from Roger, and he said, are the long haulers manifesting increased anxiety? And I'm interested in knowing that as well. So do you have what have been the impacts on your mental health or your overall outlook on life and the future, and mental health in general?
I don't know if Chris wants to answer. I saw his little box light up, but I guess I can go first. I know that it's dramatically impacted my mental health. At the beginning, it was a lot of fear and anxiety and not knowing what was happening with me. Now I struggle with a lot of days, more feelings of like hopelessness, that it's never going to get better, and fear that this will be my life now. I have a lot of, I'm a very calm person, but I've had a lot of anger. It's very difficult seeing people just openly flout the restrictions and parade around and say that it's not real when you're suffering so deeply. So that's very difficult, and obviously is very depressing at times. Being chronically ill impacts all of your relationships. And I know my husband's been amazing and so supportive, but how can this not impact a marriage when one person is basically couch bound most of the time, and you don't know if there's an end date, and you don't know if things you used to love to do together you'll ever be able to do again. Like, it's been very difficult for my mental health. And I know I was admitted to the hospital in September for a week in the pulmonary ward. And the doctors were so wonderful and asked me how I was doing and how I was feeling mentally. And when I said I was very hopeless and depressed, unfortunately, our only solutions medically are always just, well, have you tried this pill? And I'm like, well, I feel like I'm going through something that I feel like it's pretty normal to be upset about it. So I think that we need to work on maybe better solutions for everybody, but also for COVID survivors going through this, to address these very real mental health concerns that aren't just more medication that come with more side effects.
Yeah, I'm not sure if Jen wanted to speak to it, but the mental health issue, I think, is obviously it's not unique, but I think the people who have it more severe and long term, I think it just amplifies the show that we need more support. It's obviously takes a toll on everything, but when Ashley said my box lit up, it's probably just because I'm breathing. It's one of those things that we deal with minute to minute, and it does affect everything from our relationships, our ability to work, to get out of bed, to have conversations and relationships. And we don't have the proper access. I can't afford to go and see a therapist and work through these things. And I think that needs to be much more open and obvious for everybody, that going forward, this shouldn't be for people who can afford it. It should be for everyone, not just obviously COVID and long COVID survivors or people coping, but for everyone. And it's, I definitely think that if I don't get more help in the future, it's only going to get worse. It's not going to get better.
Yeah, I think for me, like I said, like the winter was pretty bleak, like just all of these things that I used to love to do, couldn't do. But I think over time, I've just tried to focus on the positives, like all the vaccines. Summer's here, even if we can't do much, at least we can go outside. So I'm just trying to be hopeful. And I mean, eventually we'll get back to where we were. But I mean, I find it's a dangerous place to kind of not look for the light at the end of the tunnel. So I'm just trying to stay positive.
Yeah, don't look outside then, Jen. It's totally snowing here.
Okay, I just saw that.
Ooh,
very upsetting.
I'm trying to be positive too, but I'm also not trying to look to my right. So thanks, Edmonton weather.
I have a window right in front of me, so I've been like staring at the snow the entire time. So, this actually leads really well into a question that was asked here by a viewer. So Ziad writes, for the physicians, does long COVID understate the true load on the healthcare system? We in the public look at daily new cases and active cases. Are there regular measures of this hidden population we can look at? And so I think that's actually a really good point. Maybe I'll start, and then Dr. Ladha, you can add to it. So one of the things that we're really unsure of right now is what sort of long-term impacts long COVID is going to have on the functioning of our healthcare system going forward, right? We really focus on these acute numbers and our hospitalizations and our ICU numbers and our cases, which is what is happening in the present right now. So we kind of focus on what the capacity of our healthcare system is right now, without again acknowledging the effects of the longer term symptoms of COVID. And so all three of our guests here today have clearly illustrated that they have been suffering with ongoing symptoms that require specialist care, that require ongoing medical care for weeks and months after their initial diagnosis, with no clear end or timeline for how long this is going to last for. And so I truly do think with all of the evidence that's coming out, with all of the new information about how long some of these symptoms are lasting for, that there is going to be an ongoing impact on primary care and our ability for our healthcare system to function in the months and years to come after this pandemic is over. And we're not even going to know the start of it really until this is all over, because it's still data and evidence that we're collecting regularly throughout the pandemic.
Yeah, I totally agree. I think, the impact will definitely be increased on the healthcare system. And I think, of course, also on the economy, because these are young people who may not be able to contribute as productively as they could have had they not acquired COVID-19. And I think most importantly is, the suffering as a community and the suffering as individuals and as a community that is such a heavy burden for all of our guests and for our community, that these people have, had COVID-19 and like Ashley was saying, never know if they're going to go back to normal. And so these are things that impact the entire community so heavily. And I think, I definitely think there's going to be consequences for many months and years to come. And I think that includes mental health consequences as well, as Chris spoke to. And I totally concur about mental health supports needing to be more affordable and accessible to everybody, because the impact of the pandemic and again of COVID, of acquiring COVID-19 or knowing people who have acquired COVID-19 and have suffered is going to last a very long time, that collective trauma. So we certainly need to improve our mental health supports as well.
Thank you. And we just have a question here. An anonymous attendee has some concerns or wants some information about schools returning to in-person learning next week. She says, they say, are we risking a flare of cases in the younger unvaccinated age group? So Dr. Ladha, maybe you want to take that one?
Yeah, sure. Thanks, Katie. So we do see in kids that they can also acquire long COVID. And so there's been some studies suggesting that up to 15% of children after even mild or asymptomatic COVID-19 infection can acquire long haul symptoms that are similar to some of the symptoms we heard about today. So certainly when we talk about children transmitting COVID, we know that whenever we close schools, transmission has gone down in the community, and whenever we reopen, transmission tends to go up. So we know there's transmission occurring. It's difficult to distance in classrooms, and it's difficult for all children to mask appropriately as well. So it certainly is a concern that if our community transmission rates are still high, that we might be putting children and also their families who might not yet be vaccinated at risk by reopening schools too soon. Having said that, I also think it's important to acknowledge that schools are an essential service. And so really, when we're looking at strategy in terms of controlling community transmission of COVID, what we really want to be doing is closing all non-essential services and businesses first, of course, with full financial support from the government, and then closing schools very last, because schools are so integral to the development socially, intellectually, emotionally for children. And then when community transmission rates are low, schools should be the first to reopen. So that's really important to keep in mind. But yes, if community transmission is high, children are at risk of acquiring things like long COVID or transmitting to family members that aren't vaccinated.
Thank you. So this is a question from an anonymous attendee that I actually wanted to direct at Ashley because you've had experience with the long COVID clinic here in Edmonton. And so, and I don't, and you know, kind of because we're not really involved in it, we don't know as much about it. So maybe you can help answer. Is there a support group for Edmonton long COVID patients? So I know that there's medical care, of course, at this long COVID clinic, but is there any extra medical support that's provided at the long COVID clinic?
Unfortunately, not yet, that I know of at least, and I speak to my doctors pretty regularly out of the long COVID clinic. It seems to be all very patient, grassroots kind of online communities. And I know Twitter has a number of communities, as so does Facebook and Reddit. But it's very helpful, obviously, to meet other survivors and have that support. But a lot of the time it's also the blind leading the blind, and we're sharing symptoms and what's going on. And it's nice to know you're not alone in going through those things, but there's nothing in terms of a professional support group or anything that's led by someone with potentially the proper credentials to lead a group like that. It would be great though, if someone would like to start one, that would be wonderful.
For sure. And, you know, as we kind of have been talking about just the mental health impact of long COVID, that unfortunately paired with how new it is and how much more we're learning about it is the downside of that, of course, is that there is going to be a lag as we learn more information about the longer term effects. But absolutely, it sounds like that would be a great thing to implement here in Edmonton and in Calgary.
Okay. So our next question is from Linda. And I think this is probably directed at the doctors. What are the thoughts when long haulers have what seems to be a relapse? Why do we cycle through a repeat of symptoms?
That's a great question, Linda. Thank you for that. You know, unfortunately, it kind of, I think, comes back to the fact that we really just don't know a lot about why long COVID happens. We don't know very much about, we're only kind of just learning about all the symptoms that take place. And we know that there's a myriad of symptoms that can occur, right? Anything from neurologic symptoms like headaches and difficulty with memory, difficulty with concentration, cardiac effects like chest pain, and they can have blood clots up to months later after their initial diagnosis. There can be abdominal symptoms and GI symptoms, and kind of the list goes on. And so unfortunately, because we're still kind of learning more and more about what symptoms are involved, what body systems are involved, and we still don't really know exactly what the cause of long COVID is, it's really hard to know kind of why it's kind of an ongoing cycle back and forth of symptoms waxing and waning. And we've heard here today from our guests, from all three of them, that there are some days that are better than others, and that, you know, some days it's completely debilitating, and other days they can, you know, somewhat function to kind of get through the day. But really, it's just that we need to get more information, and it's going to take more time to do that.
Do our guests have any thoughts on that? Do you guys experience times where your symptoms sort of wax and wane, where they where you feel like it's a relapse and it's much worse, and then they improve again?
I know for me, that's absolutely the case. And it's not just, sometimes like there'll be a good week and then you think it's going away and it's very exciting. And then it comes back and hits you like a truck again. So I think that it's amazing to wake up and be having a good day, and to know you're having a good day and you appreciate them. I know I do, at least a lot more than I did before. But it also goes to, I think, the mental health part of it, that, you know, when you're having a good day, at least for me at this point, after almost 15 months now, that I'm just expecting that one day, it could be tomorrow, it could be next week, that you'll wake up and it'll be right back again. And that's been the case, at least for me.
Yeah, for me, it's luckily it's been recurring less. My first case, I think I'd mentioned, was about a month after, but it was much more severe than my initial symptoms from COVID. So I still struggle with chest pain increased heart rates and blood pressure. But I think all in all, I think having good access to just whether it's your GP or 811 has been really helpful in mitigating how bad it is. Over this call, I've had some decently severe chest pains, but it hasn't exceeded a 5. So being able to talk to a nurse, give you some sort of measurables that you can take with you as tools as you're navigating this on your own, I think that's something that has been helpful. So, but relapses do happen, or compounded symptoms, or in Ashley's case, where it just really, really hits you, and you just have to know how you can communicate and who to reach out to. I think so. Arming yourself with that as much as possible, I think, is your best tool you have.
That's great advice. Thank you.
I just actually had a follow-up question that came to mind. So Ashley, you mentioned that you kind of talked about how when you wake up in the morning, it feels good to have a good day. Do you have a sense, like when you wake up in the morning, how your day is going to go, or have there ever been days where you might start good and then things kind of change throughout the day? Like, do you find that there's any sort of predictability to it?
I find usually when I wake up, I have the most energy. My brain fog is the least, and then it gets progressively worse throughout the day. So hopefully I'm speaking coherently now. But my body is following the exact same cycle now for every relapse. So I can tell. I get very specific gastrointestinal symptoms that I never experienced prior to this. And then I'll get a headache, and then my feet will start tingling, and then I can give you an entire list of symptoms, and I know a relapse is coming. And then the next day I wake up and I'm in a terrible place for about 5 days. And then usually it kind of relaxes a little bit, and I get a bit of reprieve for a couple of days, and then the cycle starts again. So it's become very, very, I guess, almost predictable. And that's something that's been new. I think the first 6 months, it was all over the place and crazy, but now I feel like it's following a very similar trajectory every time I have a relapse.
Thank you. So this is sort of on the same, line of relapse. Ziad has another question. For the survivors, when you look at Alberta's ICU capacity, do you check on those numbers, and how do you manage any anxiety about record numbers of people in the ICU? And are there medications or therapies that you know about, inpatient or outpatient, which you feel confident will help you if you relapse?
I feel like I'm talking a lot. I don't know if you guys want to answer and take one for this, but I know I check the numbers obsessively. I'm pretty sure that's also because I'm a type A lawyer, and obviously I've been impacted by this. So I definitely like to know what's going on. And yeah, I'm pretty terrified that the numbers are what they are. God forbid something does happen. I've also read about a lot of people with long COVID that thought they were getting better and were around my age, and I had spoken to some of them on Twitter, and we'd shared stories, and then they suddenly pass away. So that kind of stuff terrifies me. But unfortunately, there isn't much we can do but try to raise awareness and keep those numbers down by helping people to not get sick in the first place, hopefully. In terms of treatments that work, I am pretty sure I've tried every single thing. I was getting IVIG, which is intravenous immunoglobulin, to try to help my immune system. I was taking it subcutaneously at home. I've taken stuff for arthritis. I've tried to treat all of the symptoms individually, tried to change my diet and do the low histamine diet and all of the mast cell activation protocol, and I mean everything you can imagine. And I've been on a steroid inhaler as well. Some things work at first, or you think they're working, but then they stop working. So I can't tell if they're actually impacting the symptoms or my body, and then it just stops working, or if it's just I'm having a good week and it corresponds, and then I'm having a relapse, and then nothing helps. So unfortunately for me, at least, I haven't found anything that's stuck to help alleviate the symptoms.
I just wanted to highlight for anybody who's not monitoring the Zoom chat or the Facebook comments that there's been a lot of people supplying helpful information about support groups for long haulers and phone numbers for clinics that you can get help. So one of them is there's a Facebook support group. It's called COVID Long Haulers Support Group Canada. So COVID Long Haulers Support Group Canada, that's on Facebook. Also, there is a COVID clinic in Edmonton, and there's a rehab line, so a rehabilitation line that you can call for additional support. The number is 1-833-379-0563. There is also the clinic phone number, which is 780-492-3838. And there's a new group starting up in Alberta, which will be called Long COVID Kids Alberta, which will be looking at long haul symptoms in children. So a number of different resources that we're becoming aware of today that hopefully can help some of our audience members who have long COVID.
Thank you. There's also, it sounds like in the Q&A, someone, Linda wrote, there's also a spin-off of the Canada Long Haulers for Alberta. Sounds like it's a Facebook group as well. So thanks, Linda, for that. So the next question is for the guests. How is your lung function post-COVID?
Mine's awful. So it was one thing that the nurses have been able to help me, I guess, quantify is how bad is it, and is it bad enough that I need to go to the hospital? It's prior, I didn't have asthma, but I did have, I was susceptible to bronchitis, and I'd been through some lung function tests, been on Ventolin, things that didn't work. And now it's just something that I have to live with currently. As I mentioned, I'm on a puffer. It's a Symbicort steroid puffer. The prescription is for 4 times a day. I try not to do that because I don't want to be fully dependent on it. I know a lot of my friends who have asthma and take Symbicort, they do rely on it. And if they don't take it for the day, they notice it affects their whole day. So unfortunately, it's not great. It's definitely worsened, and it's not something that's recovering. And after going and getting my blood O2 checked at the hospital, even if it does feel better, it doesn't, or if it's worse, it doesn't necessarily directly correlate to my blood O2. So it's positive in that way, where if I have a really, poor lung function day or series, that it doesn't necessarily mean that I'm needing to go to the hospital or my blood O2 is bad. So that is encouraging in that way, but it's definitely something that needs to be monitored.
And irritatingly enough, mine is the exact opposite of Chris. I've had a number of pulmonary function tests and my lungs are exceptional, but when I do the 6-minute walk test, or every time I test my oxygen saturations, they're always low. And when I do the 6-minute walk test, it starts off very high at the beginning, and then by the end of the test, drops way, way, way down inexplicably. So my lungs are apparently very healthy, but my oxygen saturation is often very low. So it doesn't really make much sense, but opposite situation.
I feel the same. I've been lucky. I feel like I haven't had many lung issues at all over the entire recovery process. A little bit of a rattle at the beginning, but not bad enough. I haven't had any tests or anything, so I feel okay.
I also just wanted to point out from a medical standpoint, I guess, right? all of you have described an inability or prolonged time taking to get back to your baseline exercise capacity. And so I just want to point out that even though you may not feel that your lungs were affected, and you don't have any like lung specific symptoms in particular, that's all part and parcel of having a decreased exercise tolerance. So it's your heart system and your lung system that likely have long-term effects from your initial infection that have delayed your return to your baseline level of activity and exercise.
That's right. And I think that's a good lead to the next question, which is related about from an anonymous attendee. Do we know what COVID does to our lungs? Chest x-rays seem to be normal, but shortness of breath continues. What is the inhaler doing for us? And I think that's consistent with what a lot of you guys are saying, is that some of these symptoms are almost invisible to the medical eye. So there are tests that we do, and we may not necessarily see an abnormality on those tests, but that doesn't mean that you aren't experiencing those symptoms and that they're not debilitating. And part of that is what Dr. Mithani spoke to about this being very new, and us not having all the knowledge that we would like to have about long COVID yet. So you could be short of breath, and that doesn't mean that your chest x-ray may be abnormal, but you're still experiencing that symptom. And if you find that the inhaler works, then it likely is working for that symptom.
Yeah, and I'll just add to that we do know that that COVID causes a severe inflammation in the lungs, and it may not always be seen on the chest x-ray. That's not the best test for COVID. It's usually a CT scan, but we don't do a CT scan just from an emergency perspective, just giving you that perspective. We don't always do CT scans on patients, especially in young patients, right? Because there is a significant level of radiation that takes place with that test. And so there would be like certain criteria that would have to be met, for example, like a low oxygen level, where we might take the next step to do a CT scan. And so even though the x-rays may look normal at the cell level and at the more detailed level, we do know that COVID, especially COVID pneumonia, can cause quite severe, dramatic inflammation in the lungs initially, and then over the long term as well.
There's time for a couple more questions, and there's some on the Zoom chat that are addressed to our guests. So just one piece of information before I get to that. So there is a new long COVID clinic at the North PCN. So that's in Edmonton, Primary Care Network. And you don't have to have a positive COVID test. So some of our attendees noted that they have not had positive COVID tests. So it sounds like you can still access this resource without having a positive COVID test. So one of the questions is, any thoughts on strategies to reach family or friends that are sucked into damaging narratives? And I'll pose this to Chris, Ashley, and Jen, because I think you guys have had personal experience. So are there people like that in your lives, and what have you been able to do to address some of those myths?
I know in my life there are certainly people like that. They're not in my immediate friends and family circle, but I know some people that are one circle outside of that are anti-maskers, or people that think that this is all overblown and don't follow the regulations. So that's been very difficult. I've done my best to be very, very patient and just try to share my story, because they knew me even as an acquaintance previously and knew what my life looked like before. But unfortunately, they don't also see all of the terrible days. Even when I do things like this, I'm combing my hair and sitting up and drinking as much Gatorade as I can so I can function. They don't see the crumbled up ball on the floor after, or the person that can't stand up in the shower. So it's difficult, I think, if they have that mindset and then they see you speaking to them semi-normally, to not assume that it's overblown. But I think at this point in the pandemic, and I'm sure everyone else has much better strategies, but frankly, I'm just too exhausted, and I just don't talk to them for my own mental health, because I I've had to start intermittent fasting, and I can only eat 5 hours a day because digestion takes up too much energy. So to say that I don't have energy to deal with people like that is an understatement. So for my own mental health, I've just kind of blocked it out and just don't have them in my lives anymore.
Yeah, and I think for me, just sharing my story, I think for a lot of my friends and family, it was kind of eye-opening to see someone they actually knew get COVID. I had a couple friends say that like they just admitted they were getting a little bit more lax with the rules just because they felt young, healthy. And then when I got COVID, they were like, oh my God, okay, like this could be me. So I think that helped. Similar to Ashley though, it's exhausting. I feel like the pandemic has kind of changed how I use social media. So I feel like I try to stay away from it because it is hard to see the anti-maskers, people still gathering. So it's not the best strategy, but it's working for me.
Yeah, I guess I'm a little different. I encourage conversation. I kind of, I guess in my past, I've been big mouthed enough to have people come at me with conversations or tough questions. So I think just being open to being wrong about things for myself. I know everybody talks about, well, you know, standing your ground and doing that stuff, but also too, I'm not here to advocate and explain a doctor's diagnosis or explain what Ashley's going through. I can only talk to my personal experience, and I think connecting with people person to person is kind of our best line of defense, and recognizing, you know, kind of Jen spoke to it, is that if it can happen to us, it can happen to anyone, and you don't know what goes on with people when you're not there. People you know, don't really come at me the same way they might have beforehand. But it's because we can have those conversations, and hopefully it does build this empathy that we're lacking, because we don't have this in-person contact that we've relied on for so many years and through so many different groups. And I do have people in my life that totally believe it to be a hoax. I know people who spread misinformation, who I consider, you know, probably closer friends before than after they refuse to, you know, maybe be more open to where they're wrong. But you lead by example the best you can, and also to remember and focus on all the positive people that you've been able to affect. I have a friend, Kevin, lives out in Vancouver, and he lives in, well, generally would be living in Asia, and he's extremely fit, extremely healthy, because a model and an actor, and full-time. And these are things that he was absolutely debilitated by, and took him out to the point where he didn't know if he was going to survive it. And those are, you know, stories and people that I think are also coming out. So not just focusing on the negatives, but focusing on the positive communication and how we can help, you know, be people and share person-to-person stories like this. So thank you all for having us as well.
Thank you. We have one last question, and Chris already talked about this a little bit, so maybe we'll hear from Jen on this one. When did you start sharing your story? I get the shame game. I work in hospital and contracted COVID. I find it very hard to share. Only immediate family know.
So at first, other than my close contacts, I kind of kept it just to that, because like I said, I was the first person I knew that had COVID, so didn't really want to broadcast it. But then in December, right when there's a round of restrictions that came in, and I was just noticing through social media a bunch of friends that had been advocating for stricter measures, but then all of a sudden, now that the measures seemed to impact their daily lives, they were kind of skirting the rules and doing things that maybe they shouldn't have. So it's frustrating for me as I was recovering to see that. So I did make a big post on Instagram about that. And so then that's how that was my first shot at kind of sharing it publicly. And I did get a lot of positive response to that. But beyond that, that's pretty much all I've done until tonight.
Well, thank you so much to everyone for specifically to Ashley and Chris and Jen for sharing your stories and being so vulnerable and honest tonight. That's I think we were able to have a really heartfelt, robust conversation about the experience of COVID. And so we really thank you for that. So just in closing, we want to direct you to the Easy MSA Facebook page. There'll be some resources there. Also, thank you to everyone that participated and contributed your own resources, so that there's these support groups that people can join and can find people going through the same or similar experiences and connect in that way. So we'll just leave this screen up here. So if you want to connect here with our resources as well as those resources that were in the chat, I think we'll probably we can get EZMSA to post those on their Facebook page so that there's somewhere that people can go to access those resources as well. So thank you so much to everybody for being here. Thank you again to our panelists for sharing their stories, and be well, everyone.